I'd like the three of you to turn your attention to not the issue of what's about to happen or what is happening, but also what we can do about it. I promised myself to turn the TV off every morning because I can only take about 5 minutes. The issue of impact is clear. The question is, what are the resources we're willing to bring to bear to push back against this? And as the front line, and I'm sorry to do this to you, but you are kind of the front line, how do you see us responding? What's the most efficacious way?
So I'll try to tackle that one first, I think. I meant to say in my closing remarks, Peter, that I didn't want to end with an ugh, right? Because it just feels ugh. This all feels like heavy and hard and scary. We've seen and hopeless. But I would say two things in response to that. One is the relief funds. Let's assume that the state of New Hampshire is working really hard to put together a comprehensive application that's going to at least hopefully cushion the blow for rural populations. I'm willing to say that, their stakeholder engagement, really thoughtful about this. The other thing is, we've seen changes made in Congress that get reversed before they're actually fully implemented. And so there is, I'll be optimistic and hopeful that there is a potential, probably not in 3 years, but there's a potential that when the cliff comes, when all of these pieces come and are going to start to really crush state programs and people's lives, that cooler heads will prevail and will mitigate the damage a little bit. That's what I'm hopeful about. What are we doing about that? We're trying to position the health system to make sure that we can continue to provide care for everybody that needs it. So that's in my professional capacity, that's what I'm working to do. And then I guess I'll stop there because I don't, there's a political capacity here too. I don't know that anyone up here is going to answer that question, but that's another component. And then I'll see if my colleagues have some of that.
Ori, you want to take it?
Sure. From the mental health space, I think we're looking at survival over the next several years. That's our main focus, is hoping that the rural transformation money is going to put us in a place that we are going to be able to weather the storm to get to the other side. We are optimistic, like Matt said, that there will be more healthcare friendly policy in the future. So we are trying to weather the storm and survive. But the two things that focus on mental health parity. So Matt talked a lot about the fact that, Dartmouth can negotiate with the commercial payers to pay them more to subsidize where they get paid less. Commercial payers pay us less than Medicaid, in that they don't cover most of our services. So minimum mental health parity law that requires all payers to pay for a minimum amount of mental health care, I think is required. And then the other thing I think we really need to focus on is telling stories, because for people in elected positions, when you put a face in humanity with the programs that are being cut, it makes a huge difference. So when you see a person in your community impacted, tell the story with a name, with a face, with the impact, because that's what makes a difference.
Deborah.